Hi there. Thank you for joining me on the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen. I'm the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. We continue our conversations about the COVID-19 pandemic, how it's affecting the world, how it's affecting Guyana. And today we continue to speak with Dr. Hardat Prasad, pediatrician at the Woodlands Hospital, specifically about COVID-19 and its implications in children. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Dr. Prasad and I are at least 6 feet away from each other, and so we will take our masks off for the remainder of our chat today. Welcome, Dr. Prasad, and thank you once again for being here.
My pleasure.
Yeah. So yesterday we started talking about COVID-19 in children, and we spent some time discussing vaccination and the development of vaccine in children. You shared your views that you're optimistic, and if we have the same type of evidence for children as we do in adults, that you would be a supporter for that program. So we look forward to the results when they come out, and we would definitely be calling on you again to share your views when those results come out.
Good.
Yeah. So how has COVID impacted children in Guyana? What has been your experience in your practice here?
Well, if we look at the stats, it's perhaps less than 1% of children who get COVID will eventually end up in a hospital for COVID-like symptoms. And the major symptoms we know is cough, fever, shortness of breath.
Right.
That's the problem. It's so intertwined with other viral illnesses that
That's
you
the
can't
commonest
really
thing
tell.
kids come to you for.
Yeah.
Fever, cough, and cold.
Yeah, and we are highly exposed because they're screamers, right?
Right.
Right, so the most we can do is wear your mask properly, sanitize, and
So the one thing that I don't know how parents can do it is the social distancing from a sick kid or a kid who's dependent on you. How do you social distance from that kid when the kid is sick or you are sick?
It doesn't happen in the home.
Yeah.
It breaks down. It breaks down. So that's why we need to vaccinate.
So it's an academic advice. It's not a
yes,
practical
it's
advice
not
when it
practical.
comes to children.
Yes, yeah.
Yeah. So I agree with you, on your opinions with that.
Yeah.
Have
But-
you?
Mhm.
Go ahead.
No, I was just thinking, we haven't seen much of this in Guyana.
Right.
Maybe in the centers that see more children on a regular basis, statistically like Georgetown Hospital, they might be seeing more of the multi-symptom
Right.
inflammation syndrome,
Okay.
inflammatory syndrome, whereby the child can be asymptomatic, you don't even know that they have COVID, and then suddenly they come down in this very grave form of the disease with shock, right? When they can't hold the blood pressure, they have they're very lethargic and they run high fevers and they can actually die.
Right.
Right, that's one of the syndromes that children can actually show up with, even though they were asymptomatic in the first place.
Yeah, well, we've been lucky, I believe. I can't
Yeah.
seem to recall any death in children, and we must be very grateful for that, due to specific COVID-19.
yes.
So,
Yeah,
like the superstitious Guyanese are knock wood for that.
yeah.
I
Well,
would-
and it's statistics too. We don't
Yeah.
have the millions. We don't have the thousands. When you look at our daily figures, it's like 50 something new cases, 90 something new cases. But if you take, for example, the USA, you have 200 and something thousand.
Right.
Right. So statistically, they will be seeing those cases.
Right. So,
Yeah.
okay, so that's one benefit for not having a very dense population, I suppose.
Yeah, and then we can vaccinate, we can saturate our population easily.
Right.
It's just a matter of a month or so before we can do all 786,000 that
Live here.
Yeah, that live here.
So we would have had a couple of children who have tested positive, though,
Yes.
so far. And What kind of long-term effects do you think we might want to watch out for or to be on the lookout for in children?
Basically, these children get over it quite easily because of how their body, their anatomy and physiology is programmed. The long haulers, we haven't seen that yet. We haven't seen many of those yet, but we expect if a child has COVID and they become a long hauler, they'll be fatigued.
Right.
They won't be able to run around as much. They won't be able to concentrate on the schoolwork. There's also a possibility. But they're a very small percentage. They're something like a fraction of 1%.
Right.
Yeah.
So we have not really seen a lot of children hospitalized in
No.
Guyana for COVID.
No.
And when kids come to you now with the usual thing that they normally come with, regardless of COVID, fever, cough, cold, sneezing, do you test them or would you recommend that they get checked for COVID?
Routinely, we don't. I mean, it would be a good thing to know if you can,
Right.
if you don't find another reason for it. For example, an ear infection, or if they have a chest cold, an obvious chest cold, or so.
Yeah.
So
we have seen a particular phenomena in adults where, with the focus so much on COVID, we have almost neglected the other aspects of healthcare. People have been coming to hospital later if they have a heart attack or stroke or kidney disease, etc. Do you think that have you seen any trends like that in children, that they are seeking help for kids a little later than usual, maybe because of fear of COVID exposure in hospital and stuff?
Yes. Even if they have gastroenteritis,
Right.
they come sometimes when the child is already dehydrated and needs some IV infusions, some fluids. Asthmatic cases also coming in at a later stage than usual because of fear of coming to the hospital.
Right.
There have been a lot of, we try to encourage people to come for their routine vaccinations. Try not to miss out on that. The diphtheria, whooping cough, tetanus, and so on, the routine vaccinations. Some people have been missing a whole year because of fear of COVID.
Yeah, I've seen a lot of adult patients in my clinic who, the last time I saw them is in 2019, and the explanation is the same. Doc, with this COVID thing, I don't want to come to Georgetown. I don't want to come to hospital.
And that's why we need to have a good system where over the phone they can get some help and guidance.
Right.
Yeah.
So hopefully, there's some help and guidance that patients and non-patients can get from programs such like this, so that they can become educated about COVID, but also about other aspects of their health, that they can seek attention whenever it's necessary, and not just have a fear of COVID that paralyzes them and prevents them from seeking help when they actually really do need this assistance.
In the end, it's the basic stuff that matters. Good nutrition, wearing the mask properly, washing hands before touching face. It's the basic things that matter.
Yeah. So let's turn a little bit the discussion to a very, important topic. As we've seen, human beings are social animals. We love to interact with each other. And since we have started experiencing this pandemic, one of the first things we did, as you mentioned earlier on another program, was to close schools. And therefore, kids are at home, and they are now online, those who can afford it, doing their schooling there. What do you think the impact of that on a child is going forward?
Well, it's been a very, very deep impact on their psychology, on their physical well-being. A lot of children are showing up with more signs of obesity now because they're just at home. They're not moving, running around in the schoolyard like before. They're eating more. Parents are complaining that they want a snack. The refrigerator is being raided more often than usual. Psychologically, they need that outlet. They need, to communicate with other kids, to play, and that's not happening. They can hook up online, but still it's not the same. But I think we've been doing a good job. First of all, we are letting children understand that they have some responsibility too. We need to show by example. That's the first thing. We can't stay home and show how we are frustrated and we need to go out. What happens to the kid? We have to lead by example. We also have to show them that they can be responsible. If they can stay home, do their work online, then they'd be helping the parents. They'd be helping the grandparents,
Right.
you see? And it's just a matter of time. It's just a matter of time. Now, a lot of people are getting frustrated. You look on the TV and see what's happening in the USA right now with the spring break,
Yeah.
right? And those college students are not even college students. They're adults in the crowd there piggybacking on this, right? And, you know, it's amazing. But as we say in Russian, right? Последний бой самый трудный. What it means, the last battle is always the hardest.
Right.
This is the last battle. The vaccines are here. We just need a time now to saturate the population. And this is where people are letting down the guard. They can't take it anymore. It's just a little more. You have to just pull yourself a little more. And I think children are very good at that. Once you talk to them, once you reason with them, you show how they can play their part, you'd be surprised. They turn out to be much stronger than us.
Do you have any concerns about widening the inequality gaps for children, for example, middle-class homes and those in the lower socioeconomic status, where they may not have internet, they may not have a computer at home, they may not have a parent who is able to stay home with them, and they're therefore left in the care of a neighbor, a relative, or older sibling. How do you see that playing out?
A lot of parents are complaining that the child is basically left on its own because they don't have data or they don't have internet and so on. But that is something that is beyond us right now. We were caught in the pandemic, you understand? Yeah. We are hoping that you would have each family would have at least one laptop or phone, a smartphone.
Yeah.
Yeah, and data, of course, should be free. I feel for something like that.
Definitely during this period.
Yeah, this period data should be made free. But then, how do you stop abuse of that data?
Right.
So it's kind
There's always a propensity for
abuse.
abuse. Anything that is valuable that is then made free, or anything in general, it can be abused. So the psychological impact on children is a key area. Do you think that they will have long-term effects manifesting itself?
Children are very resilient.
So you're not concerned?
No, I'm not concerned. Not 1 year. I mean, if it goes on for 2 years, is different. But yeah.
So you don't anticipate an upsurge in depression and psychosis,
not to that extent.
Anxieties,
not with the light at the end of the tunnel already.
With vaccination.
Yes, I don't think schools will be able to open. This being practical, right? It's not my opinion. From a standpoint of being practical, I don't think Easter term will take place.
Okay.
I more see September. First of all, Easter term is a very short term. Around April, we'll be vaccinating children, I think, by then. Maybe May. And that's it. Then the summer vacations come into play. So I think September is more than likely children will be able to go out, at least in not in a hybrid way, in full.
So you anticipate that we'll be getting enough data by another couple of weeks to be able to vaccinate children?
Why not? Why not? Why not?
Now, I know you're very active in following every development in the COVID world, in the science and everything. The one big thing that people attention has been caught up by recently is some alleged linkage between the AstraZeneca vaccine and blood clots. I know you're familiar with this. We're in the same chat groups.
Yeah, well, I received you and I received the AstraZeneca. I'm now worried. I'm here smiling about any blood clots. Well, the studies the most recent studies show that the blood clots occur more in the non-vaccinated group, in the general population, compared to the vaccinated group. So technically, the vaccine is protecting you from blood clots.
Exactly.
Right? So I think, listen very carefully. When this pandemic started, it was all about humanity and sharing.
Right.
And now that they've gotten the vaccines, it's all about commercial
And
sale
corporate interests.
and corporate interests. It's all about profits now. So this is a kind of subtle war going on here with this leaking this thing about, stopping it for 2 weeks because of some blood clots and,
Right.
and it didn't pan out. I think the USA is now
Yes,
is now
today
preparing itself to
get the
accept
AstraZeneca, vaccine.
vaccine. Yes.
So thank you very much, Dr. Prasad. This has been a wonderful discussion. We certainly learned a lot from you, and we are very grateful that you found the time out of your busy schedule to be with us today. And to you, our viewers and listeners, thank you for joining us. Remember, if you have any questions, you may send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Thank you once again for joining me today.